I love to read books. I would definitely say that reading allows you to escape the real world, especially from my moderate to severe atopic dermatitis or eczema. I really did hate my skin for a very, very long time when I was younger. I was definitely my own villain in my own story because of what I thought of myself and about my skin. I am much more empowered by my skin. I'm the hero with my dermatologist, and my eczema is no longer my enemy. So my eczema started out really, really slowly. I just had a couple little bumps here and there on my middle finger. So my healthcare professional initially thought that I just had a rash or scabies or bug bites, like little flea bites. We went through a very long trial period of different creams, and none of it ended up doing anything really. It kind of just progressively got worse over the years and spread. The itching and burning started on my hands and then spread throughout my body. It was very painful. It itched really bad. I thought I just had some kind of allergic reaction. The kids would look at my hand and they'll be like, "Ew, gross. Is that contagious? Like, are you gonna give me that?" It would look so bad that I didn't want to go to school. In my early teens, I got an infection from all the itching and scratching and was hospitalized. It was then the doctor told me I had eczema. Again, we tried various prescription topical creams, which helped some of the symptoms temporarily. It wasn't until my early 20s that my partner pushed me to see her dermatologist. I was reluctant. I thought, no way this doctor is going to help me fix my skin after what I've been through. The doctor looked at my skin and immediately told me I had moderate to severe atopic dermatitis, eczema, and that there was a treatment called Adbry, tralokinumab-ldrm. She told me Adbry is a biologic injection approved for adults with moderate to severe atopic dermatitis that are not well controlled with other prescription therapies. She also explained that it may help calm the inflammation that leads to eczema symptoms. It's administered initially with a loading dose of 4 injections, then 2 maintenance injections every other week. We also discussed what to expect with treatment and the possible side effects. I went home and thought about it. I'm terrified of needles. So, I talked it over with my partner and my family. I decided to move forward and give Adbry a try since my eczema was getting out of control. The 4 injections didn't deter me from starting Adbry. I know that eczema is a lifelong chronic disease that I need to help proactively manage, and I can do that with Adbry. When I went back to my dermatologist for my initial loading dose of 4 injections, she gave me the first injection, then she had me do the next 2, and she did the last one. I felt I was ready to try this on my own. She did tell me to come into the office with my Adbry carton, and she or a nurse would help administer the injections. That was a relief and helped to make me feel comfortable. Since I've been taking Adbry, my itching and redness has greatly improved. The red and purple patches are almost gone. I definitely feel like I have trust in my skin now. I love the fact that I'm able to roll up my jeans now and not have people looking at my ankles thinking, what is wrong with her? My skin has improved so much. Obviously, this is just my experience. Everyone's experience might be different. I feel so much better, I feel so much more confident, and I think the people around me would agree with that too. They see a change in me. I would recommend Adbry just because my experience has been so amazing. This is why I wanted to share my story. You are beautiful. Your beauty is more than skin deep, and my hope is that you can feel trust in your skin. Talk to your doctor, advocate for yourself, and never, never give up. I have lived through many plots and twists in my story and can honestly say I am so excited for the future and my journey ahead.
Important safety information and indication. Do not use Adbry if you are allergic to tralokinumab or to any of its ingredients. What should I discuss with my healthcare provider before starting Adbry? Tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Adbry. Are pregnant or plan to become pregnant. It is not known whether Adbry will harm your unborn baby. There is a pregnancy exposure registry for women who use Adbry during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. If you are pregnant or become pregnant while taking Adbry, you are encouraged to enroll in the registry. You or your healthcare provider can get information and enroll you in this registry by calling 1-877-311-8972 or visiting https://mother-to-baby.org/ongoing-study/Adbry-tralokinumab. Are breastfeeding or plan to breastfeed? It is not known whether Adbry passes into your breast milk and if it can harm your baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Adbry? See the detailed Instructions for Use that comes with Adbry for information on how to prepare and inject Adbry and how to properly store and throw away, dispose of, used Adbry prefilled syringes. Use Adbry exactly as prescribed by your healthcare provider. Your healthcare provider will tell you how much Adbry to inject and when to inject it. Adbry comes as a single dose, 150 mg, prefilled syringe with needle guard. Adbry is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injection of Adbry, you or your caregiver should receive training on the right way to prepare and inject Adbry. Do not try to inject Adbry until you have been shown the right way by your healthcare provider. If you miss a dose, inject the missed dose as soon as possible, then continue with your next dose at your regular scheduled time. If you inject more Adbry than prescribed, call Poison Control at 1-800-222-1222. Your healthcare provider may prescribe other medicines to use with Adbry. Use the other prescribed medicines exactly as your healthcare provider tells you to. What are the possible side effects of Adbry? Adbry can cause serious side effects, including allergic reactions, hypersensitivity, including a severe reaction known as anaphylaxis. Stop using Adbry and tell your healthcare provider or get emergency help right away if you get any of the following symptoms: breathing problems, itching, skin rash, swelling of the face, mouth, and tongue, fainting, dizziness, feeling lightheaded, low blood pressure, hives, eye problems. Tell your healthcare provider if you have any worsening eye problems, including eye pain or changes in vision. The most common side effects of Adbry include eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia. These are not all of the possible side effects of Adbry. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. What is Adbry? Adbry, tralokinumab-ldrm injection, is a prescription medicine used to treat adults with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbry can be used with or without topical corticosteroids. It is not known if Adbry is safe and effective in children.